Hi, everybody. This is Nurse Anna from nursestudy.net, and today we're going to be doing coronary artery disease, CAD. This is going to be NCLEX questions with answers and rationales. We're about halfway done with our cardiac series. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 58-year-old male with a history of coronary artery disease, CAD, reports chest pain that radiates to the left arm. His electrocardiogram, ECG, shows ST segment elevation in leads 2, 3, and AVF. Which intervention should the nurse anticipate next? A. Administer nitroglycerin and monitor blood pressure. B. Prepare the client for percutaneous coronary intervention, PCI. C. Administer morphine sulfate for pain relief. D. Initiate continuous cardiac monitoring. Answer B. Prepare the client for percutaneous coronary intervention, PCI. Rationale: ST segment elevation in leads 2, 3, and AVF suggests an inferior myocardial infarction, MI, and PCI is the preferred treatment to restore blood flow. Nitroglycerin and morphine may be administered, but preparing for PCI is the priority intervention. Question 2. A 65-year-old female with a history of CAD is admitted with complaints of chest pain. She reports taking nitroglycerin 3 times without relief. Her vital signs are BP 150/90, heart rate 92, and respirations of 18. What is the nurse's next action? A. Administer a 4th dose of nitroglycerin. B. Notify the healthcare provider immediately. C. Administer 325 mg aspirin. D. Obtain an order for a stress test. Answer B. Notify the healthcare provider immediately. Rationale: failure to relieve chest pain after 3 doses of nitroglycerin may indicate ongoing myocardial ischemia, requiring urgent evaluation and intervention. The healthcare provider must be notified immediately for further orders. Question 3. A client with a known history of CAD presents with sudden dyspnea, diaphoresis, and chest pain. The nurse notes a blood pressure of 80/50, and the client appears pale and clammy. What is the nurse's priority action? A. Administer IV nitroglycerin. B. Elevate the client's legs to improve circulation. C. Administer a fluid bolus of normal saline. D. Place the client in high Fowler's position. Answer C. Administer a fluid bolus of normal saline. Rationale: the client is showing signs of cardiogenic shock, a complication of myocardial infarction. A fluid bolus is needed to increase blood pressure and perfusion. Nitroglycerin would further lower blood pressure and is contraindicated in this case. Question 4. A client with CAD is prescribed daily aspirin therapy. Which lab result should the nurse monitor to ensure the effectiveness of the treatment? A. Prothrombin time, PT. B. Platelet count. C. Hemoglobin and hematocrit. D. Serum cholesterol levels. Answer B. Platelet count. Rationale: aspirin works by inhibiting platelet aggregation. Monitoring platelet count ensures that the medication is effectively reducing the risk of thrombus formation without causing thrombocytopenia. Question 5. A nurse is caring for a client who has just undergone coronary artery bypass grafting, CABG. Which complication related to CAD should the nurse monitor for during the postoperative period? A. Stroke. B. Deep vein thrombosis, DVT. C. Arrhythmias. D. Pulmonary embolism. Answer C. Arrhythmias. Rationale: Post-CABG clients are at high risk for arrhythmias, particularly atrial fibrillation. Continuous cardiac monitoring is essential to detect and manage this complication early. Question 6. A client with CAD is scheduled for an exercise stress test. Which client instruction is most appropriate prior to the procedure? A. Do not eat or drink for 12 hours before the test. B. You will need to take your prescribed beta blocker before the test. C. Wear comfortable clothing and shoes suitable for exercise. D. Stop taking your statin medication 24 hours before the test. Answer: C. Wear comfortable clothing and shoes suitable for exercise. Rationale: clients undergoing an exercise stress test should wear appropriate clothing and shoes for physical activity. Beta blockers may be held as they can affect heart rate response, but statins do not need to be discontinued. Question 7. A 72-year-old male with a history of CAD presents with fatigue, nausea, and mild chest discomfort. His ECG shows T-wave inversions in the anterior leads. What is the most likely diagnosis? A. Stable angina. B. Unstable angina. C. Myocardial infarction. D. Prinzmetal angina. Answer: B. Unstable angina. Rationale: T-wave inversion in the anterior leads suggests ischemia. Unstable angina is characterized by new or worsening symptoms and requires immediate medical attention. Question 8. A nurse is reviewing discharge instructions with a client who has CAD and is prescribed a statin. Which statement by the client indicates a need for further education? A. I will take my medication at night before going to bed. B. I will avoid drinking grapefruit juice while on this medication. C. I will have my liver function tested regularly while taking this drug. D. I can stop taking the medication once my cholesterol levels are normal. Answer: D. I can stop taking the medication once my cholesterol levels are normal. Rationale: statins must be taken long-term, even if cholesterol levels normalize. Discontinuing the medication may lead to a return of high cholesterol levels and increased CAD risk. Question 9. A nurse is assessing a client with CAD who is scheduled for a coronary angiography. Which of the following is a priority assessment before the procedure? A. Renal function. B. Blood glucose levels. C. Lung sounds. D. Peripheral pulses. Answer: A. Renal function. Rationale: coronary angiography involves the use of contrast dye, which can affect renal function. It is crucial to assess kidney function before the procedure to prevent contrast-induced nephropathy. Question 10. A client with CAD is prescribed nitroglycerin for angina. The client reports experiencing a headache after taking the medication. What should the nurse advise the client? A. Stop taking the medication immediately and notify your healthcare provider. B. Headaches are a common side effect and usually decrease over time. C. Increase the dose of nitroglycerin to alleviate the headache. D. Take an over-the-counter sedative to help with the headache. Answer: B. Headaches are a common side effect and usually decrease over time. Rationale: nitroglycerin commonly causes headaches due to vasodilation, but this effect often diminishes with continued use. There is no need to stop the medication unless the headache is severe. Question 11. A nurse is caring for a client with CAD who presents with new-onset chest pain at rest. The client's troponin levels are elevated, but there are no ST segment changes on the ECG. What is the most likely diagnosis? A. Stable angina. B. Non-ST segment elevation myocardial infarction and STEMI. C. ST segment elevation myocardial infarction, STEMI. D. Prinzmetal angina. Answer: B. Non-ST segment elevation myocardial infarction, NSTEMI. Rationale: elevated troponin levels indicate myocardial injury. The absence of ST segment elevation suggests an NSTEMI, which requires immediate treatment to prevent further cardiac damage. Question 12. A client with CAD is admitted for chest pain. The nurse reviews the client's lipid profile and notes elevated LDL cholesterol levels. What dietary recommendation should the nurse provide? A. Increase your intake of red meat and dairy products. B. Incorporate more fish and olive oil into your diet. C. Avoid all fats and oils in your meals. D. Focus on a low-fiber diet to improve digestion. Answer: B. Incorporate more fish and olive oil into your diet. Rationale: a diet rich in omega-3 fatty acids, such as fish and olive oil, can help reduce LDL cholesterol levels and lower the risk of further atherosclerotic plaque development. Question 13. A nurse is educating a client with CAD on the importance of smoking cessation. Which of the following best explains why quitting smoking is essential for clients with CAD? A. Smoking increases the production of HDL cholesterol. B. Smoking causes vasodilation, leading to decreased cardiac workload. C. Smoking accelerates the development of atherosclerosis in coronary arteries. D. Smoking decreases the effectiveness of beta blockers. Answer: C. Smoking accelerates the development of atherosclerosis in coronary arteries. Rationale: smoking contributes to the development and progression of atherosclerosis, which worsens CAD by further narrowing the coronary arteries and increasing the risk of myocardial infarction. Question 14. A nurse is caring for a client who has CAD and is taking a beta blocker. What is the priority assessment for this client? A. Monitoring for hyperglycemia. B. Checking heart rate and blood pressure. C. Assessing for signs of jaundice. D. Monitoring for increased urine output. Answer: B. Checking heart rate and blood pressure. Rationale: beta blockers lower heart rate and blood pressure, reducing myocardial oxygen demand. The nurse should regularly assess these parameters to ensure they are within a safe range and to detect bradycardia or hypotension. Question 15. A client with CAD presents to the emergency department with chest pain unrelieved by nitroglycerin. What is the most appropriate initial diagnostic test for this client? A. Chest X-ray. B. 12-lead electrocardiogram ECG. C. Complete blood count CBC. D. Echocardiogram. Answer: B. 12-lead electrocardiogram ECG. Rationale: a 12-lead ECG is the first-line diagnostic test for clients presenting with chest pain, as it helps identify myocardial ischemia or infarction by detecting changes in the heart's electrical activity. Question 16. A nurse is teaching a client with CAD about the use of sublingual nitroglycerin. Which statement by the client indicates an understanding of the medication? A. I should take a pill every 15 minutes until the pain stops. B. I need to lie down before taking the nitroglycerin to avoid dizziness. C. I can take up to 5 pills if I still have chest pain after the first dose. D. I will store the nitroglycerin in the refrigerator. Answer: B. I need to lie down before taking the nitroglycerin to avoid dizziness. Rationale: nitroglycerin can cause dizziness and hypotension due to vasodilation. Clients should lie down to prevent falls and take the medication as directed, 1 pill every 5 minutes, up to 3 doses. Question 17. A client with CAD and a history of heart failure is prescribed furosemide. Which electrolyte imbalance should the nurse monitor for? A. Hypercalcemia. B. Hyperkalemia. C. Hypokalemia. D. Hypermagnesemia. Answer, C. Hypokalemia. Rationale: furosemide, a loop diuretic, can cause the loss of potassium through the urine, leading to hypokalemia. Monitoring electrolyte levels is critical to prevent complications like arrhythmias. Question 18. A client with CAD is prescribed a calcium channel blocker. What is the expected effect of this medication? A. Increased heart rate and blood pressure. B. Decreased myocardial oxygen demand. C. Increased contractility of the heart. D. Prevention of thrombus formation. Answer, B. Decreased myocardial oxygen demand. Rationale: calcium channel blockers decrease myocardial oxygen demand by lowering heart rate and blood pressure, which is beneficial in treating clients with CAD to prevent angina and ischemia. Question 19. A nurse is assessing a client with CAD who is experiencing an acute myocardial infarction. Which symptom is most concerning and requires immediate intervention? A. Severe chest pain lasting more than 30 minutes. B. Diaphoresis and nausea. C. Shortness of breath and cyanosis. D. An elevated heart rate of 110 beats per minute. Answer, C. Shortness of breath and cyanosis. Rationale: cyanosis and shortness of breath are signs of poor oxygenation and may indicate heart failure or cardiogenic shock, which requires immediate intervention to maintain oxygenation and perfusion. Question 20. A nurse is teaching a client with CAD about lifestyle changes. Which recommendation would be most effective in reducing the progression of coronary artery disease? A. You should reduce your daily intake of fruits and vegetables. B. Engage in moderate intensity exercise for at least 30 minutes a day. C. It is important to avoid all forms of dietary fat. D. Limit fluid intake to avoid overworking your heart. Answer, B. Engage in moderate intensity exercise for at least 30 minutes a day. Rationale: regular physical activity improves cardiovascular health, reduces cholesterol levels, and can help slow the progression of CAD. A diet rich in fruits and vegetables is also beneficial. Question 21. A client with CAD is scheduled for a cardiac catheterization. The nurse is explaining the risks of the procedure. Which complication should the nurse prioritize when informing the client? A. Infection at the catheter insertion site. B. Allergic reaction to contrast dye. C. Post-procedural bleeding. D. Dehydration from fasting. Answer, B. Allergic reaction to contrast dye. Rationale: an allergic reaction to the contrast dye used during cardiac catheterization can lead to life-threatening complications, such as anaphylaxis. This risk must be thoroughly explained to the client. Question 22. A nurse is caring for a client with CAD who is experiencing chest pain. Which lab result would be most indicative of myocardial injury? A. Elevated creatinine levels. B. Elevated troponin I levels. C. Decreased white blood cell count. D. Decreased hemoglobin levels. Answer, B. Elevated troponin I levels. Rationale: troponin I is a specific biomarker for myocardial injury. Elevated levels indicate damage to the heart muscle, such as in a myocardial infarction. Question 23. A client with CAD is prescribed clopidogrel. What should the nurse assess prior to administering the medication? A. Platelet count. B. Serum sodium levels. C. Liver function tests. D. Potassium levels. Answer, A. Platelet count. Rationale: clopidogrel is an antiplatelet medication that inhibits platelet aggregation. Monitoring platelet count is important to ensure the client is not at risk for bleeding complications. Question 24. A client with CAD is admitted with an acute myocardial infarction. Which medication should the nurse anticipate administering to prevent platelet aggregation? A. Metoprolol. B. Clopidogrel. C. Furosemide. D. Atorvastatin. Answer B. Clopidogrel. Rationale: clopidogrel is an antiplatelet agent used to prevent further thrombus formation in clients with acute coronary syndromes, such as myocardial infarction. Question 25. A nurse is caring for a client post-percutaneous coronary intervention, PCI. The client reports pain and swelling at the catheter insertion site. What is the nurse's priority action? A. Apply a warm compress to the site. B. Administer prescribed analgesics. C. Notify the healthcare provider immediately. D. Reassure the client that this is normal. Answer C. Notify the healthcare provider immediately. Rationale: pain and swelling at the catheter insertion site may indicate hematoma or arterial damage. Immediate intervention is required to assess and manage potential complications.